All right, Kathy, I'm back with your water,
Okay.
and we're gonna finish this, assessment up. Or do you need to go to the restroom or anything
Would
before
like
we finish? Okay. So I'm gonna give you this water, it's gonna check your hypoglossal nerve,
Okay,
to check for swallowing,
okay.
all right? Have you had any problems with swallowing or eating? You're able to eat okay?
Mm-hmm.
Yeah, we did your vital signs before you came in, they were all within normal limits, and with exception, you know, of your body mass index is a little elevated, which
Mhm.
you
Right,
discussed earlier,
right,
and that you're working on an exercise plan with that.
right.
So we're gonna finish up the rest of the assessment, that okay with you?
Yep.
Okay, so I'm gonna do a couple more things on your face,
Okay.
and then we're gonna go back to do more things on your chest and abdomen before we do some other, checking of your joints and stuff at the
Okay.
end. So I'm gonna press on your sinuses. Do you have any pressure?
Mm-mm.
I'm gonna check your maxillary sinuses. Have you had any problems with your nose?
Mm-mm.
I'm gonna just take a look. Let me get another cover. I'm just gonna look in your nose. No swelling or deviation in the septum. And then another part of the cranial nerve assessment is smell. So
Okay.
close your eyes, and I'm gonna have you smell something and tell me what it is.
Coffee?
Yes. All right, I have another substance for you to smell. And then just tell me what it is.
Vanilla?
Yes. Very good. All right, so now I'm gonna have you lay back. Wait, before you do that, I'm sorry. I'm just gonna feel your neck. Feel some of the lymph nodes. I don't feel any in the post-cervical. Have you had any problems with your thyroid in the past?
Mm-mm.
I'm gonna come behind you. I'm gonna feel your thyroid. If you could just swallow for me. Okay, I can feel the thyroid and it doesn't feel like it's enlarged. Now I'm gonna have you lay back. And I'm gonna check a blood pressure. Has your blood pressure been pretty good for you?
Mm-hmm.
Gonna get a little tight on your arm. Very good, 120/70. Sorry about that. Now I'm gonna come back on the other side of the stretcher because I need to do a couple things from that direction.
Okay.
So earlier I listened to your heart, the S1, S2. I'm gonna see if I can hear an S3. Sometimes I can't, it's not abnormal if I can't. But I'm just gonna have you turn to your, after I place my stethoscope, I'm gonna have you turn just a little bit. Okay, thank you. Now, what I'm gonna do is I'm going to inspect and palpate your abdomen. Just,
Okay.
it won't take too long.
Okay. Don't lick my fat.
I'm not looking.
Okay.
All right. Have you had any pain in your abdomen?
No.
All right, so I'm gonna lay you back just a little bit. I'm looking, inspecting to see, I don't see any abnormalities. The skin color looks good. I don't see any rashes on the extremities or on the abdomen, on the chest when I was doing your cardiac sounds. And so now what I'm gonna do is listen
Okay.
for vowel sounds. And in normal supine position like this, it's normal to be able to see the ventricular wall from the heart pumping, which I can see here. Now I'm gonna palpate it, is that okay?
Mm-hmm.
All right, now I'm gonna also do some more palpation. And nothing feels abnormal, there's no hard or tender areas in there that
No.
you've noticed, okay.
Mhm.
All right, now I'm gonna listen again, but this time I'm gonna be not listening for vowel sounds, I'm gonna be listening for your pulses in your abdomen that come down from the aorta, okay?
Okay. And neck.
And femoral. Now, I'm gonna tap on my fingers to listen for your organs, it's called percussion, okay?
Okay.
I'm gonna take my gloves off if that's okay.
Mhm.
Okay. A hollow sound is normal. All right, then you can pull your things back up. Now, we're done with that part, but what I'm gonna do is, now we're gonna sit you back up.
Okay.
And you get my dirty gloves. And bring them over here. Now, I need to feel your pulses in your feet.
Okay.
I'm gonna feel your fetal pulses, nice and strong. Color in your lower extremities is good, which means there's no indication of any peripheral problems from vascular disease. Feeling your pulses. Any leg swelling or problems at night?
Mhm.
I'm gonna just inspect and palpate. No edema noted there, so now what we're gonna do is I can get your shoes, you can put your shoes on,
Okay.
and we're gonna do a couple more things. All right, before you stand up, can you take your finger and touch your nose? And do it again. Now do it with the other hand. There you go. All right, and now I'm gonna just use an object so you can, we're gonna check your gaze, and it's part of the cranial nerves of your eyes. So if you could just look straight ahead, now
Mhm.
follow the pen unilaterally. Now we're gonna go up, we're gonna go down, we're gonna go up, we're gonna go down, and that's for the part of the cranial nerves that, to check for the muscles in your eyes, that they're controlled by that.
Okay.
A lot of these different tests that we're doing checks different cranial nerves.
Okay.
All right, so now what we're gonna do is I'm gonna have you stand up and do the Romberg test. And what that is to check your balance. So you're gonna close your eyes and put your arms out and you're gonna hold one foot up. Yeah, don't hit the stretcher.
Oh.
Okay. Are you, okay. All right, very good. Now we're gonna do the other side. Any dizziness?
No.
Oh, okay,
No.
you can put your arms down. Okay, and now if we're gonna do just another little test to see about your, I saw you walk in like I mentioned earlier, but if you could start over here and face this direction and walk heel to toe.
Well, my shoes are catching, sorry.
It's okay. Almost like doing a test out on the road. Now turn around and come back this way.
Oh,
No dizziness with that?
no.
Okay. All right, you can have a seat back down. And I'm just gonna check some reflexes on your knees. So. Very good. Very good. All right, so we're just about done here. Is there any questions that I can answer for you? Okay, well, this completes your assessment, and next time it won't be so detailed when you come in, because we've already done the, unless you have a problem, then we'll address it, and we'll go start over. All right, thank you
Okay.
very much.
Thank you.
Bye-bye.
Bye-bye.